What effect does the vaccine have on those who are currently pregnant? I'd like to start there.
Yeah. So, and I think there's a few people actually, keep seeing questions popping up about people who are pregnant
Yeah.
or wanting to
Yeah.
conceive. And I am pregnant myself. So I'm 23 weeks pregnant myself.
Congratulations.
Thank you. So lots of people have been asking me personally. So let me break it down. So let's start with pregnancy. So the first thing to say is that we don't have the data to say that it is absolutely definitely safe in pregnancy because pregnant people were excluded from the clinical trials. So we don't have that data. And we always tend to err on the side of caution when people are pregnant. We perhaps wrap them up in cotton wool and we're very cautious. So for that reason, it's not routinely offered to women who are pregnant. The
Right.
flu vaccine is offered to women who are pregnant. That's because it's been around for a long time. We know it is safe. But also, there's another difference in that in pregnancy, if you get flu, you're more likely to be severely unwell than when you're not pregnant. What we've seen with COVID-19, and there was a lot of confusion, we didn't know this at the start, but what we now know is that with COVID-19, your risk doesn't increase. The risk in terms of getting more severe disease of COVID-19 doesn't increase because you're pregnant.
Mm.
So that would, more research I'm sure would have been done perhaps if that was the case. So it's not routinely offered because there isn't the data. Having said that, the COVID-19 vaccines are non-live vaccines, and we know that non-live vaccines are otherwise deemed to be safe in pregnancy. There's no scientific plausible reason why it wouldn't be safe in pregnancy because this isn't a virus going into your body, it can't replicate. So the assumption, the scientific assumption is that almost definitely it is safe in pregnancy. And for that reason, women who are pregnant who are deemed to be at higher risk, either because they have a condition that makes them clinically vulnerable. So
Yeah.
that would be somebody with sickle cell disease, for example, or they work in a nursing home or they work in a clinical setting in A&E, for example, where
Mm.
the risk of exposure is very high. For those two groups of women, then the advice is to have a chat, an individual chat with your healthcare professional to help you balance the risks and the benefits.
Yeah.
We don't think there are any risks, but we can't say for certain because there's no data. And obviously the benefits, if you are clinically extremely vulnerable, are quite significant because if you were to get COVID-19, you'd be at high risk.
Mm.
So it's a bit of a complicated answer, but that's the full answer. And I know people next will want to know, well, have I had the vaccine? And I haven't. And the reasons why I haven't, so I had a chat with one of the nurses at work and I had COVID last year in March.
Okay.
Um, I had an antibody test in the summer, which showed I had antibodies. Also, I work as a GP, so most of my consultations are done online. So I'm not actually really at increased exposure and I don't have any underlying health conditions. So I was still a little bit unsure what was best for me to do. So what we actually repeated my antibody test and I still have antibodies. So that decision for me now is that there aren't really any huge benefits for me having the vaccine right now. I will have it, I intend to have it, but not whilst I'm pregnant.
Okay. What effect do we know the effects that the vaccine can have on fertility?
Okay, so there is zero evidence to suggest that the vaccine affects fertility. There's no evidence to suggest that. So I know there are rumours out there that it affects fertility. They are all speculative. They're not based in science or based in data. Again, there's no plausible scientific reason why it should or would affect fertility. So the scientific community, again, believe it's extremely unlikely, practically zero chance that it would, because there's no reason that it should. But again, we don't have huge amounts of data to support
Yeah.
that. So there have been tens of thousands, maybe hundreds of thousands of people in clinical trials. And from those people have gone on to get pregnant after that, but the numbers are too small to really, the numbers would suggest that therefore fertility is fine, but the numbers are too small to give us a definite answer to that. Animal studies, so these types of vaccines are tested on animals, sadly, before they're tested on us. Animal studies, they did look at fertility, they looked at pregnancy, and there was no reason for any concern
Mhm.
there. One important thing to mention is that COVID-19 itself, the infection has been shown to affect sperm count in men, not in all
Wow.
men, not in most men, but
Wow.
there has been a link between COVID-19. So currently there is no plausible reason and no evidence to suggest it affects fertility. the chances that it does are very, very close to zero. But of course, in science, you can never say for certain until you've got all of that data. So people should not be concerned about fertility. And the advice that comes out of the Royal Society of Obstetrics and Gynecology is that people who are trying to conceive can have the vaccine. We shouldn't be doing pregnancy tests on women before we vaccinate them. And if you do have the vaccine, you don't have to delay trying to get pregnant. You can continue as normal. And then finally, when it comes to breastfeeding, again, there's no suggestion that there's any reason that it's not safe in breastfeeding. I think the first thing to say is to people who are breastfeeding, don't stop, whatever you do, don't stop breastfeeding to have the vaccine, because obviously breastfeeding, if that's something that you want to do, it's great for you, it's great for your baby. But yeah, women who are breastfeeding, if they're in a clinically vulnerable group, so as we're moving now to group 7, that would be women perhaps who have diabetes, for example. If you're being offered the vaccine, breastfeeding is not a reason to not take it.